This video is going to fill a deficiency on the website. Obviously, deficiencies come up when I realize I have to say something to a patient multiple times and they couldn't find it on the website. I'm going to talk about more sort of when hair grows after hair transplant as a focus, but I'm going to touch a little bit upon the early phase of recovery, so you sort of see the window from the time you're done with the procedure until the time you're probably pretty happy with the growth. Basically, in your first week post-operative, and we have a video on this, so I'm just going to summarize it very quickly. You're going to go through a period of some swelling perhaps, and it's a minority of patients that go through swelling. I would say probably less than 10% have swelling for about 3 to 4 days on the forehead, and I would say less than 5% have it for the week. But that's something you need to consider, especially if you want to take off time from work. The other thing about it is that you don't shower for about 24 hours. You can hold ice for a couple days on the areas that are swollen or uncomfortable or sort of tender. That can be for the first 48 hours. You stay away from any kind of hairstyling product for about 3 days. And if you're on minoxidil Rogaine, you restart that about 5 to 7 days afterwards. At the end of 10 days, we take out the sutures, and if we do it, there's really not discomfort compared to other places. The reason I say that is I had a lady that shot a video and said everything was great until her sutures came out, but that was done, she had the sutures removed outside of Dallas, back in her hometown. So sutures are taken out at 10 days. You'll have little scabs that are present for that first 7 to 10 days, and we show you how to remove all the scabs. So the scabs should pretty much be all gone. So your recovery really is about a week, more or less, but there's a few patients that into their second or third week in the area that's been transplanted, they could see a little shadow effect that's still not quite there, or you can see still the little hair grafts that are present. And if you have enough hair to comb over that area, that's why we like you to keep your hair long, then that's something that usually can cover the area. Swelling really should not last more than a week, although it's theoretically, obviously anything is possible. I never want to give patients definitive parameters for that. From a period of about 6 weeks to 3 months in patients that have a lot of miniaturized hairs or baby hairs, they could have actually more shedding at that time that's possible, and women are a little bit more susceptible. That's something called Telogen Effluvium, or shock hair, where you actually lose more hair. It's always something I'm concerned about. That's why for some patients that have a lot of miniaturized hairs, or if you're a woman, I tend to put you on Rogaine around the time, plus or minus Propecia if you're a gentleman, and that may be worth it for a few weeks to a few months to be on at least 1 or 2 of the products to minimize that shock. So you may not see much growth in that phase. If anything, you may have a little bit of thinning. From about 3 months forward, you can start to have hair growth. My opinion is that 80% of people are seeing a lot of growth between 6 months to 12 months, and that's really where the principal growth is. And there's a few patients somewhere at the 3-month range that are very happy, and there are a few patients that at 9 months to 12 months are starting to get happy. So I would say the 80% rule is that somewhere between 6 to 12 months, patients are beginning to be happy. So when patients come back at 5 to 7 months, they're starting to see enough growth that they can start seeing the effect of it. It's not in full bloom, but it's starting to show up. The reason is that neovascularization or new blood supply occurs around that period of time. So patients are starting to get happy around 6 months. It starts to look much better at 12 months, and then it actually completes its cycle of growth somewhere between 18 to 24 months. So that's just to give you a cycle, but the majority of the result is between 6 to 12 months after procedure in most patients. There's one more thing that I want to talk to you about to finish this off, is the word asynchrony. What this means is that when the hair is transplanted in, what's happening is that the hair itself usually is in asynchrony. In other words, some hairs are in growth phase, some hairs are in sleepy phase, and in those phases are different cycles. When the hairs are transplanted, sometimes the hairs fall into asynchrony, where there's times where the hairs look a little bit denser and then a little bit less dense. I have a few patients, for example, 10 to 12 months out, where their hair actually thins just a little bit and they're distressed and they're worried about it. Usually what that is an indication of is sometimes that asynchrony is you're shedding and you're growing at the same phase instead of an asynchrony. It takes about 18 months to 2 years to fully return to a normal asynchrony. That only accounts for a very small component of the sort of temporary thinning, and it accounts for a small component of the fact that the hair is still going to continue to blossom and become more visually impactful somewhere into the second year. But my goal is to tell you that's more sort of that 10%, 20% change in the majority of patients. The other point of this video is to say that not everyone grows hair at the same rate. My goal is to give you sort of a ballpark so you can estimate where I think you should be. So that the golden answer is somewhere between 6 to 12 months is when you see most of your hair growing in.